I've fallen, and I can't get up.
All right, that's a commercial that's, of course, famous, and some people think it's funny, but falling is no laughing matter. While many see falling as something that only affects the elderly, young people are also at risk. To give us more insight on the topic is Dr. Nancy Yu with Southwest Medical Associates. Dr. Yu, thanks for being here today. First of all, how does someone know that they are possibly susceptible to falling down?
Well, many people can just feel weak in their legs, feel like they don't have the strength to get up from a chair easily or get out of bed easily. So these might be warning signs that that might be susceptible to a fall.
And there are some things people can do to maybe help avoid the fall. What are some of those things?
Well, some of the things might be to, get up slowly from where they're sitting or where they're in bed. But other things might be to talk to their doctor about some of the medications that might be on, because sometimes those things can make you more susceptible to those falls, get you a little uneasy.
Yeah, and these are very common medications too, antidepressants, anti-anxiety.
Right, certain blood pressure medications, if your blood pressure gets too well controlled, and sometimes your blood pressure can go low, or even sometimes some diabetic medications. If you're doing so well at controlling your diabetes, that can lower your sugars a little bit more. But certainly the anti-anxiety group is definitely something to be wary of.
And when we talk about the dangers of falling down, especially with the elderly, this can be very serious, especially if they're home alone. And even beyond that, it causes some injuries that would create a loss of independence.
Absolutely. The impact can be great. We see it all the time as physicians, where our patients might be admitted to the hospital because they've had a hip fracture. And this can cause a long road to recovery and also that loss of independence. So we really want to prevent this. We just want to keep them up and moving around and enjoying their life rather than dealing with that.
There are some prevention methods too, as far as lifestyle, what people do that could affect whether they are more susceptible to a fall.
Right. So just in general, getting a good strength training program in, of course, with the approval of your physician, but also just making sure that your house is not fall prone. So making sure loose cords and electrical wires or even rugs that are loose are not in your way. If you are somebody who just needs it, you might want to consider a cane or a walker so that you don't misstep inside your own home. But these are all things that we have to watch out for.
Well, Dr. Yu, thank you so much for being here today. Really appreciate it. And we'd like to thank Southwest Medical Group for being one of our Community Pride partners.